Okay, so for a male catheter, I'll come in the room. I'll obviously do the 2 patient identifiers and explain to them what's going on, tell them my name and everything. And then I will perform hand hygiene, put these gloves on, and I'll raise the bed to a working height. This bed, it doesn't work. Then I'll move the blanket to cover their chest, keep them warm while I'm working with their lower half, and I'll perform pericare. So after that, I'll remove these gloves and perform hand hygiene. And then I'll get my supplies ready for my catheter. So for this, when I open this, I keep in mind the 1-inch border. And then my gloves would normally be in that package, but I already have them out. And when I open these, I also keep in mind the 1-inch border on the inside. I can fix these once I get my other glove on. So when I put this on, I keep my thumb up and avoid touching. Sorry, these are like really hard to get on because I've put them on and off so many times. Alright. Okay, so at that point I can make my sterile field a little bit bigger with this. When I open this up, I have to keep it from touching the skin on my arms. And I will tuck it under. And I will open this up and drape this over the penis. So then I can start getting my supplies ready.
I mean, do they care if you like? I don't know your lab instructors. Do they care if you like? Keep like doing that. Keep the gloves on, like get them on.
When I throw anything away, I bring it towards my body and then away.
No, she like you mean like fixing my finger part?
Or like whenever like you had it on, but then like you started like pulling more like to get it on, like how you were.
As long as you don't touch this.
Ready.
I think it's. She said that's fine as long as I didn't like. If I had it in my first video, I was doing that.
Yeah.
And I was trying to get it out.
Whenever I unwrap this, I will wrap it in my hands to keep it from going into the sterile field.
And do it like that. That's how you go to
And I will lubricate the tip of
Okay.
this tube.
Yeah.
I'll have somebody else look at it and see if I have to redo it.
Once I get that ready,
Who's your instructor? Is Dylan to your lab?
They're both.
Like this. So now I can start to clean. Whenever I go to clean it, I will pull the foreskin back and grab it at a 90-degree angle, and this hand is no longer sterile. So I will go in a circular motion to clean it.
Everything else looks good, but the main thing she's looking for.
And at this point, I can start to insert the catheter. Whenever I'm inserting, I'm going to tell them to take a deep breath because they're going to feel some pressure, and then I have to keep in mind that I can't touch the skin with my dominant hand. Whenever I insert the male catheter, I insert it until I see urine flow, which is typically 7 to 9 inches. And once I see urine flow, I insert it another 1 to 2 inches. So typically with these, you try to insert them to the hub, but this one, it won't go in all the way. So at this point, I stabilize it to make sure that it doesn't come out, and I instill the fluid to inflate the balloon.
Are you doing it again? No. Cause if you pull it up close, it looks like I may have done this right past it. And she pulls up close.
Okay,
It may got that one inch.
then
I'm not 100%
I'll remove
sure.
this. Then I will
So I'm gonna say, I'm sorry.
cleanse the area around the penis because there will be lube there, and then I will lock the catheter to the side of the leg and place the catheter on the side of the bed. Then I will remove all my supplies and put it in a biohazard bag. At this point, I'm no longer sterile, so get rid of all my supplies. And I would tear this, but I'm not going to tear it just in case I have to use it again. And I'll perform hand hygiene and get rid of all my supplies, hold the sheet back up, cover them up, and make sure everything's good with that. And then to remove the catheter, I'll perform hand hygiene, put the gloves on, and then I will have I'll have like a waterproof pad to make sure that everything's okay with that. And just pretend that didn't happen. I will look at the chart and see how much fluid I instilled the first time to make sure that that amount of fluid comes out. And it should kind of come out on its own. So once all the fluid is removed, you gently pull out the catheter and you throw all of your supplies into a red biohazard bag and dispose of them as needed. Obviously this wouldn't be here. Change gloves, and then you'll do peri-care on the patient, and then cover them up, make sure they don't need anything, and you're good to go.